And welcome to the show.
Thank you so much.
She's nice to have you. When we start the conversation of health in this country, it's one that you can have for the whole day, and you'll have different angles. Many times I have gone out, been to Chirudu Hospital, which is one of the hospitals that you would think that I never want to call them locals. These days everyone seems to call them Muntuawazi, but it seems that hospitals like that should be the most accessible to Muntuawazi, like they call him these days. But they are finding it hard. And with the results from that research, you can clearly see that Ugandans, the health sector is not yet at a level where even the people like me and you, Muntu wa Wakati, that are making some good money, we still find some difficulties. But where is this trouble stemming from? Is it that Ugandans we are not earning enough money? Is it that the health system in this country is poor, or is it because the cost is so high? Where does the problem stem from?
Thank you for having me. You hit it right that there are variables which we need to consider, whether it is the question of the health system not working, whether it's a question of income inequalities. But the whole issue is, if you look at the structure of our economy, everything has become marketized. From education, from what used to be under the social contract, what used to be a public good, which the state often was accounted to ensure that it delivers on such products, on such goods. They have now become marketized and commoditized. And health, as we talk, like the education sector, is a big business. Mm-hmm. So in principle, in every system of government, whether developed countries and developing countries, public institutions are supposed, in principle, are supposed to be the most effective and the most efficient structures and institutions that you can find, which are operational. But with the commodification and marketization of the health sector, it has become the other way around, that public institutions, like you said, like health hospital, government health institutions are now rather the worst in terms of delivering, in terms of infrastructure itself, in terms of human resource.
Right.
And that makes it now the challenge that even though you have the population, and true, like you see, you put demographics, you look at the demographics of the country, 78% of the population is the youth, aged below 30. But if you look at the employability of our economy, it is that 78% that is below 30 years that is not employed. So that becomes the challenge, that with continuous marketization of the health sector, the private entities are becoming so serious in terms of development services, and unfortunately the government has seen as if to withdraw.
So we are seeing a population whereby, over 78% is the youth, a majority of whom are currently unemployed, so to speak. So when you're talking about, the muscle to spend in private hospitals, that pretty much is, something we can't even talk about. A majority cannot afford this. But let's go into the current status of, the healthcare system, of course, with a keen focus on the private sector, but the keen focus on the public sector, but also bearing in mind that also the private sector is struggling. That's because you're seeing, them that can afford it, the bigwigs in the country, whenever they fall ill, as much as we have private health institutions in the country, they still go out to seek for medical health care. So the private sector is also not having it easy. But let's stick to the public sector, where you're saying ideally they ought to be the most efficient, facilities, across the country. Then why isn't that the case, so to speak?
Yes, thank you. I don't intend to politicize the show, but if I may take you back, immediate post-independent Uganda, when the late Obote's Excellency was shot at an attempted assassination, he was operated on at Murago Hospital. Those used to be the functional state institutions. Even his wife used to give birth to from Mulago Hospital, because you had the medical. I mean, and it goes back to the fact that with privatization, the narrative that we keep receiving from the development partners like the World Bank, the narrative of privatization and a hands-off approach which the state seeks to be, not only the Ugandan state, by the way, all African countries and actually developing countries have taken now a hands-off approach where you now have the private sector, and unfortunately, like you said, which is now even ailing. We don't have a private sector in the first instance in Uganda. That's for argument's sake, but that's the reality. So you find that you have the economy trusted in an entity which is the private sector, but which is also ailing. What is the end result? The end result is that you are going to continue having shoddy packages, because the government entrusts that the private sector is going to drive the economy to where we want it to go. But unfortunately, the private sector is in for a killing. So I mean, it is in to make business. So those are the challenges that you end up.
You see, every single time you talk about the economy and how Ugandans are struggling and how they don't have jobs,
yes.
When you wake up in the morning and take a stroll right now in Kampala,
yeah.
when you go through the suburbs in Kampala here, that's not the reflection that you get, because like you said, yes, it has been privatized and everyone is looking to make a kill from it. So if we the people don't have the finances to keep these businesses running, then what explains the uprising of all these pharmacies, all these clinics at every single corner? If we don't have the money to sustain that sector, why is it that there is one opening up every single month and they are making money, they are improving?
Exactly. Yeah, that's a very amazing question. I remember being asked that question when I was in Marrakesh for the Global Health meeting, and I'll give you the same response I gave. Because we have been left with no option as poor Ugandans, that our health system, like my sister rightly put it, the government sector, the public sector, there are no medicines, there are no infrastructures, there is no doctor to work on you, and so you find that you are between the devil and the deep, what they call the devil and the deep sea, about surviving, you know, and it's a question of life and death. So you end up even selling the last property that you have to access the medical services, because they know that the infrastructure, there is no supportive public health care system in Uganda, and so because it's not working, there's a big business when you decide to join in the private sector. So because they know we don't have any other option. Otherwise, if they knew that our public systems are working, especially in the health sector, health insurance is working, then exactly.
You talk about public institutions, and then you talk about the healthcare. We've had a discussion on the national healthcare and how now it should be a discussion that we are getting into. Is it, in your view, is that feasible? Is that something that we can have in this country? Of course, looking at the fact that Ugandans have already complained. My friend Malai here earns some good money,
yes.
but she's one of those that are saying, well, it's very good, but you people are already taking my pay as you earn. You people are already taking my, there's this and this. Now you want to take some more, another percentage in insurance, in health insurance. Is that something feasible? Is it something that is only going to target my friend Malahia, who is earning pretty well, so that people like me who are not earning well can squeeze into his insurance and get that? Or is that a possible plan?
Mara, I should give to Caesar what belongs to Caesar.
I do, by the way.
Sure you do. But yes, to your question, if you look at the way the scheme has been designed, indeed, you the employed, I'm not among them, but you the employed ones are going to, yes, you and Mara are going to take the burden. 4% will be deducted from your salary, and then your employer will be able, who is statutory, they will add 1% to make it 5%. Now, there is a system where they are proposing that because the informal sector, actually, which comprises now 80% of our economy. Yes, the informal sector. There's no way it is supposed to be to also be taxed through what they call community health schemes. But the challenge is the informal sector is not organized.
And that's the thing, because when this proposal came to the fore, they were saying that them that are in the informal sector will pretty much be mandated to contribute 100,000 Uganda shillings per year to this particular scheme. So how feasible is that, especially knowing that there are no structures? Well, we always say that the formal sector still struggles with clean and solid structures. So how feasible will that be in the informal sector if the formal sector is struggling with the basics? Yes. How about the informal sector? Will this really take off?
And I'm glad you raised that question, because when you look at as a good citizen, when you look at the investments or at the initiatives that have been taken by the government of Uganda, you will see that while in principle these are for a noble cause, but they are prematurely conceived. They are not really well conceived before they are into action. You can take the Bombardier case, you can take the solid fruit factory case, you can take, we have had vast government initiatives which you have not taken enough time to study the operating environment before you undertake into making them operational. So that affects the implementation. And this is the same fate of the health insurance scheme, because you have no means of taxing the informal sector. But at the same time, you remember this SAGE program where you're giving people either 50,000 Uganda shillings, and you are saying that you want to tax that. And then there's this argument that government is going to subsidize the informal sector. But let us look at the question of where is it going to get these funds from the budget to the health sector. Currently, the health sector funding is 7.3% of the budget,
right?
Which is still very low compared to what the Abuja Declaration says that they should commit 15%.
But a majority actually saying that probably the national health insurance would be a magic bullet to sorting out matters to do with funding in the health sector, so to speak. They say that now if there's health insurance, then this monies will aid somewhat in pretty much helping in the provision of the different aspects in healthcare. For example, matters to do with drug stockouts will be sorted out, matters to do with now making sure that different health institutions are well staffed, so to speak. Is that a magic bullet? Will it work for us in that aspect, especially when you're looking at funding? I
totally disagree, because with respect to your submission, but still I totally disagree, because when you look at the picture, the writing is on the wall, and maybe our policymakers are not reading it, but if you look at our health system, it's crumbling, by the way. We have districts, 39 districts, which don't have even a single health center. So tell me, how will the health insurance scheme be of benefit to them? We are having, currently in Uganda, we have a shortage of 45% of medical workforce, which is lacking. So even though you are increasing on the scheme, are you increasing on the doctor-patient ratio? Are you increasing on the packages? Remuneration to the medical workforce to ensure that you retain the brightest brain in the country and stop brain drain. So we need first of all make the health structure work.
It's interesting because it's not something that we are not aware of. Yes. It's a discussion that we have had years and years on how the health sector in the country is crumbling. But every single district that you go to, there is a road being constructed. Every single district. So is it a question of keeping the nationals healthy or growing the economy of the country and growing its stature as a country? Yes, many will say, well, we don't have our priorities straight. So if the health sector is crumbling, and we all think that that is where our priorities should be, then what should be done? Should we go to every single district and say every single district has to have a referral hospital that is fully functional at whatever cost? Even if it means that that district won't have a proper road to the referral hospital, let's have the hospital running in full force. Is that what we should be doing?
No, not really. Not the bit of whatever cost. Not really. I totally agree with you that these things are complementary. You need infrastructure. You need roads, for example, to ease in supporting production.
Yes, you need electricity.
Exactly. I strongly agree with you. Yeah. But when we go, for argument's sake, when we take the question of setting priorities fact, let's take an example of this elephant project, the Rubawa Hospital. Yeah. Okay, and I'm glad that NTV has done a wonderful documentary on this, stories on this whole initiative. We as civil society, we have been saying that, look, we already have hospitals, government hospitals, which are lacking, which you could get such monies, the 700 and something billion US dollars, put it into the already existing government health systems and make them functional. Then you can start thinking of other undertakings. So yes, it's the question of priorities. That's why I go back and say that, like I was saying, that we don't first of all undertake our research to see what is because the Uganda Medical Association comes up with what they call a health barometer every financial year, and it selects in the barometer, it shows what are the specific priorities. While there are others which are required, which are essential, but there are those which are which need to be prioritized. We need to follow that. For example, we need to have, for example, experts, for example, in terms of brain neurosurgery, open heart surgery, and all that. We don't have the Cancer Institute functional. The Heart Institute is not working, and we're investing in another project. So this is the question of how do we set the strategies right, the priorities right.
You mentioned that just one more before I give Mother some space here, but. Later on last year into this year, I was faced with an incident where I had a relative of mine who got a heart problem. Yes. We went to the Heart Institute. Yes. And I was faced with one of the biggest challenges I'd ever faced, especially when it comes to the health sector in this country. And this patient needed a pacer. Yes. And I was shocked that in a country, this beautiful country, where we're not wasting, we're investing billions of money in infrastructure, we can't get a simple pacer for a patient that could lose their lives in less than 12 hours. Yes. So is it a case of putting up all these hospitals and having all these wonderful looking, we had recently a hospital in Mulago that has been renovated, and all these machines are in there. But on the other hand, we are shipping off nurses and doctors to go to Abu Dhabi. We don't have enough medicines. We keep putting up that claim. But recently when I was in Chirudu Hospital, Dr. gladly told me that the medicines have been provided. Well, they're being taken out of the hospitals into public hospitals, but they're there. The medicines are there. Yes. So what is the hold up? This is not a case of just priorities. Because as a public hospital, a heart institute in this country, and I would think that the basics that you would need is at least a heart pacer. You don't have one. So what is going on?
I'm glad that at least you are facing the realities of what the common people go through, and this goes back to the question of the health governance in the health sector. We have privatized a lot, and the role of the government has dwindled. That now you find that even people in the health sector, in the public institutions, are operating private entities. Now, I'm not accusing anyone of anything here. Okay. But I have often instances. My dad got a head surgery, a brain surgery some years back, 2014, and I would go to Mbara Hospital, and they don't have the medicine, and then they prescribe you to
A pharmacy?
Yes, and that,
so that, you can
that would be
it.
yes,
a
drug of 500,000 per week every. I mean, this is the aspect that you need to regulate. We have oftentimes seen medicines which are meant for government end up in. So it's a question of.
We can't keep blaming the government the whole time, because even us as Ugandans, me and you, as soon as you get sick, it's very rare that someone that is earning some fair, good amount of money goes to a government hospital. The first thing we are thinking of is, let's fly to Nairobi. Let's go to an international hospital. Let's go to a private institution. We haven't trusted these hospitals enough.
Do you know why? If my leader is not trusting the hospital, why should I?
Okay.
That's the question.
You are an economist in the country, and I'm sure you look at all these facets and you try to see how are they linking to each other and what could ultimately be, the solution. You have spoken so well, and this is the reality on the ground, so to speak. We always have this conversation. What would ideally be the solution? Is it, bottom up or up bottom? Looking at the structure, you have said that clearly, we're even struggling with staffing because a majority go through medical school. Very expensive course to take, takes forever,
a long time.
And then someone graduates and thinks, okay, fine, this was the entire investment I had to make to go through medical school. And when I go into the job market, I'm being paid peanuts. So that's where a majority actually going abroad to look for employment. Okay. So number one, staffing has not been sorted out, and I think unless we crack that nut, it will forever be an issue. People will be graduating and flying abroad to go there. The other issue, you did say that, as much as even for them that will not go abroad to work there, they will start their side private hustle. If not a pharmacy, then a clinic. Then would you say that the ultimate solution is for the government to turn back what they did and to move back on the hand of privatizing the health sector? Would that ideally be our ultimate solution?
Thank you, Mara. That is the first. That's among the other things that need to be done. That's the first action, that we have marketized the health sector. By the way, even the so-called government hospitals, there are those private entities where you have to pay
an extra.
Expedite. Exactly, in order to expedite you. Otherwise, you breathe out and you die. You just go to government hospitals.
I was there.
Exactly. So, and by the way, to say that out of pockets, like you were saying, that what when we get out of your pocket and you pay to be worked on and all that, they constitute 60% of the income of the health sector. So that we are having high out of pocket fees. This is already a squeezed population because of tax burden, and we even want to access medical services there. So yes, but we have privatized a lot. We have marketized the health, social services, by the way, not only health, even education. Let us go back. You used to find that I am young, but at least I have read, and you find that working for the public sector was one of the prestigious jobs within, And so let the doctor. Give them no reason for why they should even start up their, That's the surprisingly. In the COMESA grouping and even in the tripartite grouping, Uganda exports medical workers to Botswana.
Right.
It exports ARVs to Botswana. It exports medical workers to South Africa, to Trinidad and Tobago. We are exporting, and these are specialists, by the way, not specialists.
But Chiza, someone would argue that, as much as we're saying let's go back, let's actually, reverse the privatization of the health sector, and it being the ultimate solution to the problems that you're facing in the health sector currently, someone would say that ultimately, maybe or ideally, would be shooting ourselves in the leg, because we're saying we return or reverse that to what? And they say that, already government health institutions are suffering. The culture there is deplorable. There was a cartoon that was making rounds on social media, Uncle D here being the king of social media, and it was saying that, how you find, I think it was just, a meme and a cartoon showing how you find health workers, and their attitude towards work in a public institution. And in a private institution is much better because, you know, there's monitoring systems and stuff like that. So someone would say, if we reverse that, if we reverse privatization, then what will we be left with if the public sector, so to speak, is quote unquote, like you're saying, not working at all?
I'd just like to add what Malai is saying. Yes, let's not try and reverse things to where they actually are not working. Let's see, we have clearly seen that the private sector has more. It gives more. So how about we get all these government hospitals and facilities that are not working like they should? How about we privatize them, and then we put a task on that, we put something on their earnings to make sure that we give back to the Ugandans so that they can afford to go to that hospital.
Uncle D, you cannot trust the future and the health of your citizens with the money makers and the tax collectors, the private sector. You just cannot. You cannot profitize health sector. This, I mean, that we can argue on that, but that is the aspect. Let us go back. In my earlier submission, I'd say that we used to have an efficient and good working public systems, health sector. Maraga gave an example of Marago. We used to have, but the fact that we have relaxed in our role of this as the state, you know, and that is, by the way, a behavior issue. And sometimes, like you are saying, what needs to be done, attitude can also be taught. You can take an example of Singapore. You know, sometimes by government, when I was doing policy making, I learned that inaction can also be a policy. When government decided to do nothing, that can also be regarded as government's policy, to do nothing. But if the government came up and said, if somebody starts saying that we need to start having an accountability, for example, on how the medical equipment in the hospitals, the public institutions, is being utilized, believe me, systems can work.
Corruption.
So yes.
Let's talk about corruption in a nutshell. As an economist, how would we sort that issue? Because someone would say corruption is in the public sector, it's in the private sector, it's everywhere. So how do we sort out that issue in the health sector?
Yes, I think in my view, in my humble opinion, one is the remuneration of the health sector, of the health service. Yes.
Do you think people get into corruption because they're not paid enough? Will we ever get to a point whereby someone wakes up and they're like, yes, now I'm being paid enough, I will not do anything on the side, or I will not engage myself in illegal stuff? Do you think a human being can ever be satisfied with what they're being paid?
Not necessarily, but even makes it even more, it makes it more tragic. I mean, if you find that you are even now less paid, if you're less remunerated, that even gives you more cause to, but that's the beginning. That, of course, it takes time. It takes time, moments to be able to be sieved out, to change the attitude and the behavior.
The value systems.
Absolutely. Thank you. Exactly. But really, if you know that a doctor wakes up, he has a good housing allowance, he has a good health insurance for his family, he has a good remuneration, a good salary and all that, at least there is that, we are human, there is that humanity in him as to why they should now put priorities of, because it's a calling. Medical service is a calling, as they usually say. Right. So he has that aspect of, at least let's save lives. But the issue is, as long as my thoughts as a doctor have been on, believe me, I'll better attend to someone who is willing to pay, and I leave you to languish in there. So that's the aspect that, yes, it first of all takes the fact that we need to appreciate the health system, the health workers, including the nurses, by the way. We should not really segregate on who gets what. This is the medical profession.
The whole package.
Absolutely.
Okay. Thank you very much. Chiza Africa. Very, very interesting names. We need to meet your parents and have a discussion on how they come up with this. An economist from Siatini here joining us this morning, and we're looking at the findings that were shared from a report by Twaweza that indicated that only that citizens, 53% decided government hospitals, we're not going there. And we're trying to find out why are Ugandans shunning government facilities. Trying to get more understanding into that is what we've been doing this morning on our Take Note conversation. Thank you very much. So which one should I go for? Is Miss Africa
either is fine.
So Mrs. is Miss who?
Huh?
Your Mrs. when you finally get married, you call him Miss Africa?
Perhaps.
Yes,
that would. I love that. I love African. It's African.
And I can already imagine what is going to happen to your children. We're probably going to have one called Kampala, the other Uganda, maybe South Africa or something like that.
I was actually South Africa initially.
Oh, really?
When I was born.
And then we decided.
No. My mom knocked off the South.
Yeah.
Okay.
Congratulations. And the knocking off. Mr. Cheese Africa joining us today for our Take Note conversation. Thank you very much for sparing some time to share your knowledge and understanding with us. And thank you very much as well for being part of the conversation. The hashtag is morning at NTV. If there is anything that you want to chip in with, please use that hashtag on our social media platforms. In a few minutes, we're going to be getting into our business updates. Mala is already set and ready for that. Morning at NTV continues right after this.
The long line hassle. With OneXBet, the power of placing the perfect bet is at your fingertips. Bet anytime from anywhere. Best of all,